Hey everyone, Dr. Ashley here from the Feldman Physical Therapy and Performance team. Thanks so much for tuning in. Today I wanted to chat a little bit more about the female athlete and a question that was posed to me after my recent set of videos about the importance of the menstrual cycle in the female athlete. One of the big things that people often talk about is birth control to treat menstrual irregularity, and I'm going to broach that subject a little bit more today. So make sure you stay tuned to the end to know the reasons why or why not birth control should be used to treat menstrual irregularity in the female athlete. So guys, if you are enjoying our content, make sure you hit the subscribe button below and share our channel with your friends. We're always trying to share the latest and greatest information with you. So as always, I want to get started, so let's chat a little bit more about why birth control should not be used as a band-aid when taking care of menstrual dysfunction in the female athlete. I have talked about the importance of a woman's menstrual cycle before. I always say, a woman's cycle is what gives you superpowers. When we have our period every month, that is a good indicator that we are in awesome health to perform really well. We can fly, we can run, we can do everything without a higher chance of injury. It's not normal for a woman to lose her period, and it's not normal for somebody to tell you that it's okay to lose your period, because truthfully, it's not. It used to be thought of a sign as peak athleticism, and that's no longer true. What do we note with women who lose their period, especially due to exercising too much or what we call low energy availability? We see things such as gastrointestinal distress, brain fog, fatigue, and even things such as stress fractures. And none of this is okay. And we also don't want these to be overlooked by using birth control. So let's chat a little bit more as to why birth control may not be the answer for treating menstrual irregularity in the female athlete. For years, it has been common practice that physicians prescribe hormonal birth control, such as injectables or oral contraceptive pills, to those who have menstrual irregularity. The reason why: a female's reproductive hormones don't just have to do with reproduction. They also have to do with our cardiovascular system, gastrointestinal system, and our metabolic processes that help us lay down a healthy bone. They also help us maintain skeletal muscle tissue. So let's think about this. What's one reason as to why birth control may be prescribed for those who have menstrual irregularity? Bone health. The thought was that prescribing hormonal contraception, so these oral contraceptive pills or these injections that women get, would help kind of instigate the menstrual cycle and kind of help it come on and kind of, make a woman actually have their cycle every month. However, the problem with this is that sometimes it masks other things that are required or that we're required to look for when we're trying to figure out why menstrual irregularity is happening. The other thing is that we've actually seen in research that taking an oral contraceptive pill does not necessarily help our bone mineral density. If anything, it keeps that bone mineral density where it was. It doesn't let it increase, and sometimes we actually may see a decrease over time because a woman's hormones may be suppressed a little bit. And the other thing is that it doesn't fix the problem, possibly. And let's dive into that a little bit more. So why is hormonal birth control not necessarily the answer when it comes to female athletes with menstrual irregularity? I will note, if you are a female athlete who's been diagnosed with polycystic ovarian syndrome, endometriosis, pelvic inflammatory disease, or many other things, and you use hormonal birth control to regulate your menstrual cycle, that's okay. For all of you other female athletes or providers of female athletes who all of a sudden just have this irregularity of their menstrual cycle or loss of menstrual cycle, before prescribing hormonal birth control, we need to look at this individual with a wider lens and from a bigger perspective. There are many things that can go into the loss of the menstrual cycle. Things such as relative energy deficiency, so not having enough energy to fuel your body properly. Overtraining, that's another one we really need to look at. Lack of sleep, lack of recovery. And basically, if we don't have enough energy in our body starts to pull from those areas that they do not think are vital. And for certain female athletes, the reproductive system becomes that area, and that's why the menstrual cycle stops. We have to make sure that these individuals are not suffering from disordered eating, and we need to make sure that they are actually healthy to perform. So if oral contraception or say injectable contraception is prescribed or given and we do not get to the bottom of things beforehand, then we're masking the problems. And also, if we don't mask these problems, we may be able to make individuals get back to normal and have a normal menstrual cycle without having to ever prescribe hormonal contraception. So, ladies and gentlemen, I want you to think about this a little bit more. I want you to think that hormonal contraception is not the first line of defense, especially when treating menstrual irregularity in the female athlete. The reasons: we haven't necessarily seen a really positive correlation in bone health. It doesn't necessarily increase our bone deposition. If anything, it helps it stay at one level. Okay. The other thing is we can mask the things we really need to look for, and that's not okay. If we do note that someone has relative energy deficiency, we need to make sure there's an appropriate care team in place. A physical therapist if there's an injury going on, a psychologist, say a gynecologist if necessary, a pediatrician. We need to make sure that these individuals are getting what they need. And of course, I can't forget the nutritionist. So everyone, as always, if you have any questions, please don't hesitate to ask. Always look forward to hearing from you, and we love sharing the latest and greatest content. So put your comments below, and we'll get back to you as soon as we can.